in the medical office, but you're less inclined to do them if you don't know to whom you're going to refer. Because every other chronic relapsing illness, you know immediately. You'll pick up the phone, you write a referral, you make a referral, and they're in to see that specialist very quickly. That's where we know a huge gap is. And the knowledge of the treatment for medical providers, they don't know where the treatment is, where they should be referring this patient to.
I was actually wanted to get back to the kind of the medical intervention that takes place, and I think that it's a similar model to what the homeless do in Boston, and that was to invest money into a position that really the homeless would come into the hospitals and cost a lot of money to use services, and once they were provided with those services, we saw probably 10 times the amount of money that was saved rather than not having the services that were provided for the homeless. And I think in the medical term, what the doc was saying was, what do we do with them in the meantime? You know, they just keep coming back in, and you're treating the same abscesses and these and we're paying for that anyways. And ultimately, if there's a position that's created that's a crisis intervention, because it's easy to say like intervention and not say, just use that term. Well, there needs to be an intervention. Well, what does that look like? And having somebody that the EMT, that the police departments, that the medical fraternities, the hospitals, and those doctors can call, and that their job is to navigate that intervention, will probably save a great deal of money compared to what we pay for that person to be in the hospital. And ultimately, those people with a game of seconds and inches to get into recovery, that small window, if they're met at that time, like when you said you didn't get called, if it's met at that time with somebody that actually knows how to navigate state-funded treatment, private treatment, the local resources, and they can do it for them, probably is going to save us a lot more money in the long haul.
And in Rhode Island, they kind of turn
Yeah, you know, this is a public health crisis in our community. We have to, we really have to be able to look at what we have in place around prevention, intervention, treatment, and recovery, and make sure it is seamless so people can get help when they need it, that we're doing a better job at prevention, so that we don't have to deal with this forever. This is a huge problem in the community, and we're gonna not only rally the community, but take action.
I think it's huge because this is one of a number of conversations that are happening around the state, and I think for this city and this region, this is hopefully the beginning. You know, I mean, Manchester is the hot spot for our heroin epidemic right now, and I think if it doesn't change here, it won't change anywhere else. So I think this is an incredibly exciting opportunity to get treatment and recovery available to people who need it in the right way at the right place.
Well, the reason why I'm here is I don't believe Manchester has the luxury now to plan. So I'm hoping to invoke action, which this meeting looks like it's going to be taking action. That's really what I'm hoping for, is taking action and not just planning.
I think the voice is getting louder, and I think that's the first most important thing. And again, the four-legged stool needs to be built so that we all understand what's out there and how do we find treatment, how do we find recovery, but it's got to be readily available.
How important is this issue?
Very, very important. It's an epidemic.
I think this meeting this morning was really important because it has brought together all of the pieces of the pie, I look at it like, and they're getting to understand what at a state level has been going on behind the scenes and at a city level what's been going on behind the scenes, so that each group doesn't just go out and try to start their own thing. It's bringing everybody together in a true continuum of care, and finally recognizing people in recovery and recovery support services as the missing link of this continuum of care. That's why I'm pretty hopeful, and the mayor is extremely supportive, and he really understands that there is this full continuum of care, like not just one thing is going to fix this problem. So I'm really encouraged today.